Seniors Flourish. Quick tips.
Hi, this is Mandy from Seniors Flourish. My quick tip today is just talking briefly about ice and heat. I love ice and heat because it helps with pain control and it's cheap, something we can do at home, and it's natural. So starting off with ice, you want to use it for any kind of aches and pains that happen acutely or something that happens immediately. So like a sprain or strain, a gout flare-up, or some kind of instant pain, back pain where you're bending over and pick something and you feel like your back's going out. So those are the types of injuries that you want to definitely use ice. It helps with inflammation and swelling, it numbs the pain, it constricts the blood vessels. It's kind of like if you imagine the ice is just kind of shrinking everything up to kind of numb it up and keep it, help with the pain, keep it under control. On the flip side, when you use heat, you want it on injuries or pains that you've had for over about 6 weeks. So chronic pains, those backs that you've had hurting for years, shoulder pain from surgery that you had months ago, arthritis. Heat is great for arthritis. It kind of just really penetrates deep. It increases the blood flow. It helps those muscles relax. It helps with those aches and pains. So that is when it's great to use heat. One thing you need to really make sure you do is make sure that you have some kind of barrier between the ice and the heat and your skin. So you want a towel between the ice pack or the heat pack, because the idea is that you are numbing the pain and trying to help control the pain, but it also means that you lose that sensation a little bit and can't really feel how cold or how hot the packs are. So you want to make sure that you have a towel and make sure that you don't, get frostbite or burn yourself. And so you want to check your skin regularly. And the other thing you really want to kind of focus on is making sure that you don't use heat on an injury that just occurred. So on those sprains, strains, those gout flare-ups that we talked about, you don't want to use heat because heat increases the blood flow. And so if you already have something that's inflamed and then you put heat on it, it's actually inflaming it more, and it kind of helps it delays the healing process. So we don't want to use heat on acute injuries. If you have any other questions for our quick tips, feel free to comment below or subscribe to our YouTube channel, or feel free to follow us on Facebook or Pinterest, or check us out at www.seniorsflourish.com.